Hello everyone, welcome to the second episode of AHPI's Digital Health Podcast series. In this episode, we are going to talk about how digital technologies can improve the quality in healthcare. For this second episode, we have Dr. Girdhar Gyani with us. Dr. Girdhar Gyani has been called as a founder of healthcare quality in India with his work on NABH and the initial implementation of the NABH. So welcome Dr. Gyani on this second episode of the podcast.
Thank you very much.
So before let's start the podcast, and so as I mentioned, right, you have been called as the founder of healthcare quality in India. So if you could identify what are the key foundation parameters for the quality in healthcare in India or over the globe.
Okay, thank you very much. Actually, the quality in healthcare is different when you compare with other sectors, because here the quality is related to the patient safety, and patient safety means minimizing the medical errors.
Right.
Ultimately, that leads to reducing the mortality, morbidity. So, in a way, the quality in healthcare is amounting to saving the lives of the human being. So, that way it is very different.
Right.
And that's why we always categorize the quality in two parts. One is the service quality,
right,
which patient normally experiences. You go to hospital, how you are attended, what is the empathy factor, what is the communication factor. These things the patient will say, okay, this is a good hospital.
Right.
But the real quality, as per we are concerned as the medical professions, is the clinical quality.
Right.
Now, in clinical quality, as I said just now, that we will have to create a framework in the governance of the hospital, so that one, it is system based. Number two, we have the standard of preparation for various aspects. The standard guidelines are followed by the doctor, nurses and everybody in the hospital. And at the end of it, the outcomes are measured. That means, let us say, surgical site infection, we do measure. A urinary tract infection, we do measure. Now that measurement actually will tell you that how has been the clinical quality. So that is the basic difference between healthcare quality and other quality in other sector like automobile, communication.
Right. So at the end of the day, in healthcare quality, the end output is the better life for the patients and reduce the errors which is being generated in the hospitals. Right?
Yes.
Now, so recently all of us know, right, there is a AI, there is a digital technology. So how digital technology helps in improving this foundation of patient safety or hospital quality?
Yeah. You see, the digital technology, actually again I will qualify or classify this into three parts. One is the medical technology, which is basically concerning with the, let us say, radiology, diagnostic equipment. Now, as we are making sophisticated diagnostic equipment, that means the diagnosis is improving. And once the diagnosis is improving, it is easy for doctor to decide the treatment plan.
Right.
So that is the medical technology. Other is the information technology, use of information technology within the hospital.
Right.
Now, within the hospital, you must have heard, we call it nowadays smart hospital.
Correct.
Okay?
Yeah.
Now, in a smart hospital, suppose a trauma patient comes, serious accident, and immediately we rush him, take the blood sample and rush him to the operation theatre.
Right.
Now, while the surgeon is going to open the body, in the meantime, at the lab, we get the results and they are transferred in real time to the surgeon's table there. So he is able to correlate the treatment plan and what kind of surgery he should or should not be doing it. So this information technology application within the hospital, what we call digital hospital or
Smart
hospital, is very important. The third aspect is beyond. That means even when the patient is at home, so we have wearable devices nowadays.
Right.
So we can monitor the patient right when he is at home, more so with the geriatric patients, or home health care. So through telemedicine and through these wearable devices, So that is the third component of the technology. So I said medical technology, then smart hospital within the hospital, and third is beyond. So in all respect, if you see, we are improving diagnosis, we are improving accessibility. Otherwise, patient has to travel.
Correct.
That accessibility. And third, if you really see, the robotics have come now.
Yeah.
Now, doctors sitting in Australia can operate patient in India.
Yeah.
Suppose he has the expertise which we do not have, and there is a robot available here. He can operate it from there, and you can see the results are mind-boggling. So I think all in all, if you ask me, healthcare has to be driven now by the technology.
Right.
And world over, the engineers who work in hospitals, we have started calling them as clinical engineers, not biomedical. Clinical engineer, because they have important role to play along with the surgeon or the physician.
Correct. So when we talk about these technologies, right, and as you rightly mentioned that it is benefiting hospitals as well as patient at large, even if we talk about cross country or cross continent, then also it is benefiting. But still, if we specifically talk about India, right, in India there are a lot of challenges, or still hospitals administrators are not keen on implementing these digital technologies. So how can these hospitals overcome the challenge and implement these digital tools to improve their profitability, revenue, as well as the patient outcome at the end?
You see, this definitely, there is a challenge, because this change management which we talk, there is always resistance in changing. More so, the doctors who are in the age group of 45, 50, 55, actually these are the doctors whom we consider as experienced, really. But the issue is they have never studied this in their curriculum.
Correct.
Now it becomes very difficult to change them at the age of 50 and 55.
True.
But I think what I have been saying as an association, AHPI, in fact, our slogan is that in next 3 years from now, if the hospital is not digital or smart, particularly in the metro towns, patient will not go there.
Very true.
Because now patients have started realizing they don't want to stand in the queue.
Right.
They also keep knowing from the media or from their own sources that so and so hospital has got CT of that level, MRI of that level. They are that kind of people in metro I'm talking. So hospital now have to perforce train their senior doctors also in adopting the medical technology or information technology. At least one way it is happening is that in robotic cases, all senior people only do the surgery.
Correct.
They are enjoying now switching over from laparoscopic to robotics. So that change is happening, but in the information technology, taking down the notes on the iPad. That many doctors still are not comfortable. But I can tell you, it is a question of time. Very soon, I think they will realize that particularly younger generation who are in the college, now they are using the technology in their curriculum while they are studying.
Right. So let's move on to the next thing. And as a part of NABH's initial accreditation team, right, as one of the co-founder, I would say, of NABH and implementing the accreditation along the breadth of India. So how does digital tool can help the newer hospitals? And I was actually going through one study. So in India there is close to 35,000 hospitals overall, but there are only 2,000 hospitals which is NABH accredited, right? And NABH being a quality standard in India, a lot of hospitals are still implementing it, or they are not even aware about that. So how does this digital tool can help all the hospitals in improving or getting accredited with NABH very quickly and efficiently?
One, let me tell you, when we released the first standard in year 2006, right in the first standard there was a 10th chapter on HIS.
Oh.
Yes, Healthcare Information Systems. So foundation was laid right in 2006. Then every 4 years we have been upgrading the standard.
Right.
And similarly this 10th chapter also keeps upgrading. So whichever hospital has to take NABH, it has to perforce use the information technology. Maybe the level may be initial, little medium level or little advanced level, but hospital has to demonstrate application of information technology within the system. That is for sure. Of late, NABH now has come with a specific exclusive standard on the medical technology or healthcare technology.
Right.
So that now the hospitals which are already accredited, now they are going for this revised standard or the new standard, which is only showing the application of information technology.
Correct.
So that is a one encouragement which is happening. Third, of course, is that Ministry of Health under the National Health Authority has launched the National Digital Health Mission.
Correct.
Now that push also is coming.
Right.
Hopefully, in time to come, we may introduce regulation by the government to become to use the, let us say, electronic health record, which is very key or foundation of improving the healthcare services in India. For example, a patient has got diagnostic done in Delhi 1 year back, and he or she goes to Chennai, meets suppose with some accident. Now, operability of the electronic record, if it is from Delhi, with a switch off button, we can get the records on Chennai. So there is no need of repeat test. So this is a huge benefit.
Definitely.
So this government is pushing.
Yeah.
We are also working, by the way, AHPI is partnering with the National Health Authority, and we have identified initially 32 hospitals as a pilot project of implementing the National Digital Health Mission. So I keep saying there are two areas. If the Ayushman Bharat, which is covering 40% of population of India, and National Digital Health Mission, if you are able to push these two schemes, our health system, I think we can outbeat any country.
I like to refer this as the UPI of healthcare, especially ABDM. The way UPI transformed the financial institution in India, ABDM has a scope of doing that at a larger scale. Definitely it will take another 5 years or so. But
see, ABDM has got a lot of components. For example, Aadhaar, we have to issue the number for each of the citizens. Then we have to prepare the directory of all the doctors. Then the geo-tagging is happening now, where we will come to know. Actually, you said there are 30 or 40,000 hospitals, but nobody knows actually what is the exact number.
Correct.
So geo-tagging using ISRO technology, we will be able to find out how many nursing home, hospital, diagnostic center, trauma centers, even chemist shop.
Right.
So that, as you are saying, it will take 3 to 5 years, but that will be the biggest boon for improving the healthcare in India.
Right. So moving on to the next, now we understand that India has a huge potential in healthcare and especially in digital health technology. As a Director General of AHPI or as a AHPI body, what kind of initiative you are taking to implement digital technologies into the quality processes of hospitals?
Yeah, that's right. You see, our challenge is basically to work with the smaller and mid-sized hospitals.
Right.
You see, around 6,000 hospitals are there in India which has got 100 bed and above.
Right.
You don't have to work with them now because they have to use medical technology to survive in the market.
Correct.
Because they are tertiary care. Then one of the guesses is that between 30 to 100 bed, we have roughly 25,000 hospitals. These are the potential hospitals which have reasonable infrastructure and which needs upgradation to make them, let us say, smart hospital or digital hospital.
Right.
So what we have done now, we have made a committee on the digital health. We have 20 chapters. So this committee is working and transferring from time to time what needs to be done to these 20 chapters. and where we have got these 30 to 100 bed hospitals. Further challenge will be, which we have yet to work, is below 30 bed. Small nursing homes which are spread around in the villages or in the small towns.
Right.
They firstly do not have inclination. Secondly, their basic infrastructure is not enough. But I think that can wait.
Right.
Our target is to work on this 25,000 hospital with 30 bed to 100 bed. And that is what we are doing through our 20 chapters, number of webinars we are doing. And this committee, central committee, which is working, for example, recently they have done the, for example, stroke. Stroke is one of the area which needs promotion.
Right.
And stroke means we have to tell public that these symptoms rush to the hospital where there is a CT. Now, if he goes to a nursing home, there is no CT, he is wasting time. Because after 4.5 hours, that is a golden period.
Right.
The clot you cannot dissolve.
Right.
And then this person will become disabled for throughout the life. So we have released the guideline now on the stroke for the public as well as for the doctors.
Okay.
More so for the smaller hospital. Then we are working on the how actually the adult vaccination we can work on. So these are the areas which is being worked out by us. Our strength is these 20 chapters.
Right.
So whole India is covered through these 20 chapters.
Nice. So being in the healthcare industry for more than I think 40 to 50 years, right? What do you think? What are the next 5 or 10 years are going to look like, especially in the healthcare and technology, and especially in the quality delivery of the healthcare?
Okay. So again, I will break it in 3 parts. The first part is, which we have not done aggressively, is helping community through promotive and preventive health.
Yeah.
You see, there is no point that we keep on spending money on curative health.
Right.
One study says that if you spend 1 rupee on promotive and preventive, you can save 5 to 10 rupees in the curative part. Now, what is this promotive and preventive? Telling community, more so in the villages, safe drinking water, sanitation, nutrition. If these 3 things we are able to tell our community, I can assure you that the burden on hospital will come down drastically. So that is the one area. Now, second area is where I am seeing the next 5 to 10 years. One is we are going to get more number of specialists trained because of the shortage of the specialists, we are not able to have these specialists in tier 3 towns. So that, you see, we can talk of technology later.
Right.
First you have to have doctors.
True.
First you have to have hospital in tier 3 town.
Right.
So we have told government very strongly now that please incentivize private sector to establish 100-bedded hospital in tier 3 town.
Okay.
That strong recommendation has gone. Once this part happens, then the third part comes. What you are now referring is that use of technology. And for that, our recommendation to government is, because most of the radiology equipment are imported.
Right.
Government is definitely pushing on indigenization, but it will take maybe another 5 years. Till that time, we want actually the custom duty on these equipment should be reduced. Number 2, we should encourage the overseas companies to come and assemble equipment in India to reduce the cost.
Right.
And for which government, I think, has already put the technology park. You must be knowing 5 technology park have been used. Only Visakhapatnam actually is doing wonderful work, but others are still to. So that is the third component which government must do it. So once this technology comes, our diagnosis will improve, morbidity will come down, mortality will come down, and the average life span today is only 73 years.
Right.
If you compare with South Korea, it is 84 years.
Yeah.
So I think we have still 10 years to cover. And that can always be done if you use the technology.
Great. So at the ending of this podcast, what advice would you give healthcare institution as well as patient in improving the overall quality of healthcare in India?
So one is that our community should be made aware about their healthcare needs.
Right.
Second is the insurance aspect. We keep talking that healthcare is expensive, but actually nobody knows how much is the cost of delivering one particular procedure.
Right.
Today the parents give highest priority on education of their children. Buying car, taking good house. They don't think about the healthcare. They think I am okay. So I think they have to be made aware, no, healthcare is an important component of your life. Go for insurance. So once you make the people aware about their healthcare needs, also help them to make sure that they keep financial provision through the insurance. This is on the community side. On the hospital side, you see, the only way is that we promote, as you said, that is still a long way to go in making hospital accredited.
Right.
Once hospital is accredited, that means it has got the system where doctors are practicing standard treatment guidelines. Clinical indicators are being monitored, managerial indicators are being monitored, outcomes are being looked into. So by doing this, once it becomes habit, and all hospital across suppose get the NABH. Now to give the push to NABH, the one thing which Government of India did long back in 2007, that if you are accredited by NABH, then in CGHS you get 15% more money. Now if this incentive is applied by all state government, all schemes, even private insurance, that will give the huge push to the hospital.
Okay.
So one end we tell community that please go to the hospital which is accredited. Similarly, tell payers that they should give incentive to the hospital which are accredited. So I think that is the way that, for example, today if you see you want to buy cable, you go for ISI mark. Pressure cooker, ISI mark. So time should come that people in hospital before entering they should say, are you accredited? I think that is the way its journey will continue. Only thing is, today unfortunately we have around less than 2 beds per 1,000 population in India. You need 3.5 beds per 1,000 as per WHO. So is quality, if you talk demand and supply. Now demand is huge, supply is limited. So I think quality will take the back seat.
True.
So the push should go, as I said earlier, to establish new hospital in tier 3 towns. Once the supply is available, demand already is there. So I think then there will be pressure on the hospital automatically to deliver quality. So these factors, combined together. So it is not a simple one initiative. Every initiative have worked together, which I think now government also has become conscious. Public, of course, is already becoming conscious about the healthcare needs. But this has to be further, pushed aggressively in villages, smaller towns, so that ultimately last point is that if you have healthy people, the productivity will be high, economic growth will be high. So I think many times we don't consider health as part of the economic development of the country.
Right.
All the developed country, if you see, whether it is Japan, South Korea, or even the Western country, because the health indicators there are good, their economy is also is good.
True.
So our Prime Minister is talking 2047, we will become the Vishwaguru or we will become the developed nation. So that in that health definitely has got very important role to play.
Great. So health is equal to the economic growth of India.
Absolutely.
That we can say.
Absolutely.
That's a really nice way to end this podcast. So at the end, I would like to thank you for being on the second episode of this podcast. Thank you so much.
Thank you very much.